My name's Nikki Schuler. I'm going to be doing this scenario on Dilaudid. We have an order here for Dilaudid 0.5 to 1.5 milligrams every 3 hours for a 35-year-old male who has cancer of the pancreas. He's been complaining of pain on a 9 out of 10 scale. At 7:30, he'd already received 0.5 milligrams of Dilaudid, and he's still complaining of that 9 out of 10, and it's 8:30 now. So we've done the math, and that means we can give 0.5 to another mil of Dilaudid. So what I'm going to do is, because I already have TPN and D5 1/2 NS running in my medial and proximal port, I'm going to take my distal port and scrub it with chlorhexidine and alcohol wipes for 15 minutes, or 15 seconds, and then I'm going to waste about 5 mils of blood to make sure that we're not pushing through any of that leftover heparin. So then I'm going to scrub again and flush with my flush and make sure that we're getting rid of all that extra medication or anything that's left in there. And then I'm going to administer about 0.5 or a mil of Dilaudid, so we can maybe cover that pain for the next 2 hours that he has left. So I'm going to push this for 2 minutes, so we've diluted it up to 2 mils with normal saline. So I've pushed that for 2 minutes, and then I flush for 2 minutes to make sure that the remaining medication in the tubing is getting administered at the rate it needs to be administered at. When I'm finished, I'm going to scrub again, or wipe my port, and hep lock it again. When they are on Dilaudid, we need to monitor and reassess their pain levels and make sure that we're keeping it covered. If the pain isn't still being covered, maybe we should call a physician and see if there's anything else we can do for the pain. Also, we're going to want to monitor the blood pressure and respiratory status, because this narcotic can send you into respiratory depression or make you hypotensive. And so we just really want to keep a close eye on that. We're going to want to have Narcan available and ready to go, because that's the antidote, and we just don't want, if they're in any type of respiratory depression, we want to be able to reverse that as quickly as we can. All right.